Thanks, Lawrence. Yeah.
Great.
Morning, everyone.
Morning.
One more question. Who is not in the industry but interested in getting into the CBD industry? Okay. All right. It's an exciting journey. So I flew in from Montreal last night. I'm actually a Canadian. I'm based in, practice was based in Montreal. I practiced in Europe for approximately 5 years. And the Canadian framework for cannabinoid therapy, we'll call it, or cannabis, is that we have a federally regulated medical system. We're about to have a federally regulated recreational system October 17th, which is big news on a international level, especially with us being neighbors to the US of A. So I've had quite a few years of patients coming into practice asking about cannabinoids for their health and potential. I was not prescribing at the time, but I would make recommendations to go speak to their prescribing physician, which was quite an amazing experience in terms of what we would see patients come back reporting. And to be able to do all that in a federally regulated system was really quite amazing, is quite amazing. So I want to share my experience. I'll say this is not I'll call it boring discussion about regulatory issues in different jurisdictions and states. I'm looking to present more of a topic from my perspective as a brand and what we see, because we are California based. We have some THC products in California. We have CBD products in the US with great national distribution coming online. And then we have international opportunities. So the brand is we're very pleased to say, in demand. We've got Canadian national distribution opportunities into pharmacy chains, and we've got international opportunities as well. So I want to lay out that sort of point of view perspective from the brand perspective. We do obviously have information at hand because we are involved in all the nitty-gritty details running the different products and different SKUs in all these different jurisdictions, and having to make packaging decisions and regulatory labeling decisions and all sorts of things like that. So we'll share the insight from our perspective, and hopefully for the people who are interested in getting into the industry, it doesn't scare you away. I think the opportunity is terrific, and ultimately the opportunity to help people is really fantastic and exciting. So I'll just start with a personal story. In practice, as a chiropractor, I'm focused on musculoskeletal issues. I've seen pretty much every pain under the sun. I know how people respond and what they respond to, and you see the medication side of it. You see people who have to head off to surgery for more serious matters. And so in Canada, I'd have patients coming in, as I mentioned, asking, how can cannabis help them? And in Canada, there's no differentiation really between CBD and THC. It actually all falls under the same regulatory framework. So the advice would be consider perhaps a ratio or something more CBD focused. And so I had this experience a few years back where a couple who I'd known for many years, they are married, but he was actually a retired priest in a previous life, and she was a retired nun. And I don't think retired is the right word, but you know what I mean. And they had gone into education. He had got a degree in medical ethics and law. She had got degrees in education, and they had really excellent, prominent careers. But unfortunately, she suffered from neuropathy and fibromyalgia and all sorts of bowel disorders. And so she had many medications and multiple medications all at the same time. And so I saw her health deteriorating over the 15 years that I knew her, and she would come to me for neuropathy-related complaints in her, primarily in her feet. But I would see her deteriorating with time. And so one day, both of them were in the clinic together, and I said, I think you should go off and get a prescription for cannabis. And so I'm saying this to this couple in their mid-80s, and he's a medical professor, ethics professor. So I wasn't quite sure how this advice was going to go, was going to be taken. But in the end, they said, yeah, we'll go and investigate. So they came back a week later saying, we're doing all this research, and they can tap into, the prominent medical community, and they got lots of great advice. And then a week after that, she got a prescription. And so a few weeks later, I saw her change very dramatically in terms of her overall, her outlook, her sleep, her pain level. It was really amazing to see. So that struck me for two reasons. One, that age group, with all the potential stigma around cannabis and cannabinoids, we're still willing to go that length to change their health. And number two was that if you could picture this, if you know Canadian climate in Montreal, this was in the wintertime. It was probably, I have to say in Celsius, it was probably minus 20 in Celsius, whatever that converts to. They had to go outside and stand on their balcony to smoke their joint for their medicine. So that struck me as not a great health approach, right? So I did more investigation. I attended conferences and did a lot of research, and it became very clear that cannabinoid therapy offers really fantastic potential across a wide spectrum of health concerns. And it offered a spectacular opportunity, because what I saw were some brands which were perhaps they were smaller brands. They had been developed in a certain way, but I come from this clinical background where I'm going to make a recommendation for a product, and people have to be able to trust the efficacy and the way the product is made, and all that sort of stuff. So in the end, I embarked on a journey to develop a brand of topical products, and we had great access to biochemists and formulators in Canada, university researchers, branding expertise, packaging expertise. So we ended up on this terrific journey, and we launched cannabis products, THC based in California. But this conference obviously is more about the CBD side of stuff. But I do have this perspective that in Canada there's not that much differentiation between the CBD market and the THC market. It's all part of the same regulatory framework, and I'll show you a slide further on where that's the case in many countries. So the US happens to have this framework here with hemp being classified and the Farm Bill, and then THC obviously being very restricted as a psychogenic psychoactive molecule. So I don't want to necessarily get into much science, because we want to talk more about the regulatory system, but just to be clear, in cannabinoid therapy, what you're really talking about are these cannabinoids, which are plant-derived, and you have the count is high, but the two main components, CBD as one of the more prominent cannabinoids, and THC is one of the more prominent cannabinoids, and then you have all these terpenes. So all these molecules that give it the aroma or the smell that people might be familiar with. And then from a clinical perspective, the endocannabinoid system, which I'm sure most of you have heard about at this point, so I won't go into it too much. But from a clinical perspective, again, to consider that there could be this system that acts as an overall regulator. And so if you can impact this overall regulator with an extremely extensive array of receptors throughout the body, you have this exceptional opportunity to help many, many, many things. And that's one of the most common questions I have, is that people who are not familiar with CBD or cannabis, how can it help this, and this? That seems to be impossible. But if you understand that your endocannabinoid system is throughout your body, and you are impacting your body's function or your regulatory framework at that level, there is great potential to help if you can really influence something up here, as opposed to at a more specific targeted level. So CBD offers many potential opportunities, anti-inflammatory being the biggest one, and convulsants, antioxidant. The one that gets the most attention is really the anti-inflammatory, and then the anticonvulsant, because regulatory-wise, if you've seen, the FDA recently approved Epidiolex as a pharmaceutical drug. So it is because of CBD's effect in that situation. So does anyone want to hear a little more about endocannabinoid system, or are we all? There are some newbies, and let me just say, from my perspective, when you're working with the body, in the 20 years that I did, you know, the more natural approach you can take, usually the better. You know, fewer side effects. And so when you look at cannabinoids, you have this system where your body already makes molecules, which I'll just describe as like a mirror image of what's in the plant. So your body has this endocannabinoid system. It produces endocannabinoids. And it just so happens that the cannabis plant or the hemp plant has cannabinoids in it, phytocannabinoids, so derived from plant material that happen to be mirror images of what your body's already producing. So what a fantastic opportunity. Your body is already making something, and here you can supplement it with matter that comes from the plant. So you know, it's very likely that the side effects of that are minimal, and your body's response to it is in a more natural state. So that's primarily my interest, and so when we looked at how the endocannabinoid system can be influenced by these external plant cannabinoids, for me it made sense to use it in a topical fashion, and so that's where the brand ended up coming from. So I think part of the challenge from a regulatory framework is that this system is so vast within the body, and it's so complex, and the plant just naturally has so many different components, from the terpenes to cannabinoids to many other things. And if you've heard some other talks this morning, the science talks, you know, science is able to measure one thing, you know, quite well, right? But if you mix a few things together, that measurement gets tougher to do. And so if you mix many things together, it becomes much tougher to do. And really, science is not set up to measure that in the first place. So the whole pharmaceutical world is about having one molecule and measuring that effect. So how do we measure something that has this potential effect overall on many systems within your body and seems to respond better if there are multiple molecules at work all at the same time? So if you consider the potential combinations of all these different cannabinoids, all these different terpenes, and all of that working together, it gets extremely complicated. So how does a regulatory framework handle that? And it's my, I'll say my personal opinion, my clinical opinion, that it really should end up in more of a nutraceutical classification as opposed to a pharmaceutical classification. So it can be used more as a supplement as opposed to a prescription drug. And I think ultimately for cost as well, there's some information out there about the cost of Epidiolex compared to other sources of CBD. So I think ultimately the I'll say human population at the end of the day would benefit if something is perhaps less regulated. But at the same time, you still, you know, you do need to have regulations in place, right? If a physician is going to make a recommendation, we need to know what's in it, what's the concentration, what exactly is the patient going to be taking, and what is the likely effect from that. So like a full carte blanche of no regulation, I don't think is beneficial either, but having regulation in place so that you know what the product is, how it's tested, it's pesticide free, and then you, as science develops around it, will have better sense of which cannabinoids interact with which and what terpene profiles make more sense. So, you know, it really is at the start of this very fascinating journey in cannabinoid therapy, and you know, hopefully regulations allow it to head in what I would describe as an excellent direction of full potential in terms of what we suspect humans can develop from, or benefit from. Sorry. So this is a little more the nitty-gritty detail in the regulatory landscape. So as I mentioned, our brand, we have products in the THC market. We have products in the CBD market in the US. We have THC CBD products coming out in Canada. We have CBD products heading to other international markets. So all of these countries and all these regulatory bodies are trying to figure all this out. So just to give you an idea, in Canada, as I mentioned, it's federally regulated. There are sales taxes on things. You see a lot of vertical integration because companies get a permit, and they get a permit to grow, and then a permit to manufacture, and then a permit to sell. So you see quite a bit of vertical integration and concentration among some of these. I'm sure everybody's heard of these legal, these LPs, some of them with massive market caps at this point, the Canopies of the world and the Auroras of the world. So Canada's in this great position because we do have this regulatory framework in place, which is allowing research to come online, and it's allowing companies to develop, it's allowing financial markets to support that. So it's quite an exciting time in Canada. And then we have a federal system, and then we have a provincial system. So the provinces can also then say, well, we want it sold this way, and we want a certain age restriction on it. So then, it would be similar to state by state. We now have provincial regulations which may allow full public market commercial retail, and others which might restrict to a provincially owned retail body. So even within a country where it's quite regulated, there are still these differences between these different provinces. So then Germany, we put Germany up on the list here, especially from a Canadian perspective, because Canada has this federally regulated system. We're able to export. Germany allows import. So Canada can export to Germany, although I think you're going to see a lot of countries come out with their own regulations and try and bring things internally, control, but also create business opportunity for their own industries within their own borders. Switzerland is quite interesting, especially in the CBD market. You've probably heard that there's quite a bit of CBD produced in Switzerland, and then there are also stories out there that there's CBD produced in other countries that get shipped to Switzerland and might get rebadged as Swiss CBD and then exported somewhere else. And then Switzerland actually views CBD more like tobacco. So you can buy CBD cigarettes in corner stores, basically, as far as I understand. But then other products, cosmetics, topicals, pharmaceuticals, have more of a restrictive framework. So Switzerland seems to be ahead of the game a little bit, but they haven't quite figured out their own regulatory framework around the difference between THC and CBD. And then Israel gets quite a bit of press because they do have quite a bit of research going on. Obviously, the original research in terms of endocannabinoid system and identifying CBD and identifying THC. So we could put many, many other countries up on this slide. There are things changing so quickly. It's really quite dramatic, quite amazing, and it's quite fun to be a part of as well. So here's what's applicable in this situation. I think people have heard of the Farm Bill. There is a Farm Bill that's been put forward by Mitch McConnell, which will change the CBD market very, I'll say very dramatically. It is scheduled, I believe, for the end of the month. Perhaps someone could, what's the date? 25th of September? Yeah. Okay. So, the framework here so far is that you have hemp defined as a plant that has low concentration THC and a few other characteristics to it, but you can pull CBD from hemp and you can pull CBD from cannabis. So the CBD molecule doesn't change wherever you get it from. It's a molecule and it doesn't matter. But to pull it from hemp, which has a low concentration of CBD, it gets reclassified as hemp-derived CBD, and so the regulatory framework develops around that. And so what we're seeing is that with this potential change in the Farm Bill, national retailers are looking at the opportunity for CBD, and that landscape is changing very dramatically. So for us as a brand, we're very fortunate to be speaking to some major players who are looking at the Farm Bill and saying, okay, within 3 months of this passing, we're going to move. Some of them are saying, we know it's going to pass, so we're moving now. Others are saying, we're going to wait 6 months and then we'll be ready. But they're such massive retailers that they have to get things in place long ahead of time, and they have to work it into their sales channels and all sorts of things, right? But I truly believe there is now a race on to CBD distribution into mainstream retail. So think about every major retailer out there, from the beauty cosmetic world to the pharmacy world to the niche healthy food stores. I'll put it that way. They're all eyeing this space very closely, and we know, in fact, that there are a whole bunch of buyers at shows like this as well, trying to figure out what products do they feel they can bring into their network. So it's super exciting for an industry, and I think at the end of the day you got to tie it back to why are we here, why am I here, and it's really about being able to help people. So it looks like around the corner we have this fantastic opportunity to be able to get products into mainstream distribution and help many, many people. So that's really fascinating. One of the things we face as a brand in those channels is that they want to know liability questions primarily, right? Their legal counsels are saying we're a bit concerned about some ingestibles, maybe some topicals have lower risk, so maybe we'll start with those. And then they want to know right down your supply chain, how are you manufacturing this? Are all your manufacturers certified ISO 9000, GMP, and do you have all your lab testing in place? Can you certify that it's 0% THC? Can you certify that it has zero pesticide in it? Can you handle capacity? Because they're going to come in with massive purchase orders, and so is your infrastructure set up to be able to scale the way they're going to want to scale? So all the certification that goes with it, all the packaging that goes with it, the claim side of stuff, the barcodes, how they process products through their distribution channels, becomes a very big challenge. But again, a super challenge, super opportunity, because we know a lot of people are going to get lots of help as these products start to go really mainstream. So California, I put this slide up because there's an interesting debate right now about CBD in California. So California has rolled out its regulatory framework for cannabis, and if anyone's aware, there was quite a bit of trouble around January 1st getting things compliant and into the permitted system, and then July 1st was another big date for the industry, and lots of challenges around packaging and testing and all sorts of things. And it sounds like December 31st, January 1st is going to be another challenge around some more regulatory framework and testing. But so California's spending a lot of money and getting all this in place, and obviously wants tax revenue from it as well. So now as a state, they're eyeing the CBD side of stuff. And so are we going to allow CBD from outside of California, and how's that going to work into the system? So there's a lot of stuff in flux, and I just bring it back to us as a brand, as a company. How do we handle all this in terms of packaging requirements and tamper-proof and child-proof and all sorts of stuff, right? So there are big challenges that we live day to day based on the regulatory framework that's in flux. I'll call it that. So as the interstate situation comes up, so obviously transporting cannabis with THC across state lines is federally illegal. Having CBD certified hemp is going to be much clearer once the Farm Bill hopefully passes through its course. So, and then on an association or a body of a regulatory body, you see some very fascinating changes. Has anyone heard about the World Health Organization making moves on cannabinoids? Right, they're studying regulatory framework. They're studying risk associated with CBD. They're studying THC. They're studying what's happening in all these countries, right? Because all these countries are not suddenly, but they're working towards changing all of their regulatory frameworks. So how's the World Health Organization going to handle that, and what sort of position is the World Health Organization going to have? So it does sound like CBD is one of the first things that's going to move at the World Health Organization level. And then the Olympic Committee and the International Olympic Committee and pro sports. I'm quite fascinated by this. If anyone saw the CNN documentary, Sanjay Gupta interviewing some of the NFL football players, right? One of the comments that struck me is that through their league regulations and drug testing, they are basically, I'll call it, funneled into medication use and opioid use. And so these players were making the point, this stuff I know works for me. I know it's non-addictive, helps me recover. I want to be able to use this through my professional career as opposed to being pushed that way. So, from a personal perspective, it's their job, it's their career. That's a very legitimate argument to make. So it's going to be very interesting to see what these leagues do again, from a CBD brand perspective, we get lots of interest for CBD products. We're topical. We're great for anti-inflammatory and things that will bother you as a result of being a professional athlete. So, and then the NBA seems to be a little more open-minded about it, and so you see players and comments from them being a little more open-minded than the NFL. And then there's the mixed martial arts, which I'll say as a health professional, I'm not that fond of watching people beat each other up. But they've made a move to allow their athletes to use cannabinoids. So quite a fascinating time from the associations. And then there's the retired players associations, which once you're out of the sport and your livelihood is not dependent on passing a drug test, then they often come out more publicly stating being in favor of cannabinoids. And so you see lots of retired athletes either starting their own brands and trying to move the dial that way, move the needle that way, or coming out publicly speaking and being interviewed on CNN and putting their weight behind it. There are some groups, some associations of players have come together to try and push regulations forward. So we have some slides on consumer demand, because what I really feel is happening here is that consumer demand is driving a lot of the regulatory decisions, and there's so much consumer demand here. So I'd like to quote Brightfield Group, who do a lot of great research. Lawrence, you want to talk about some of the consumer demand, or are you happy for me to keep going here? Okay. And I realize we're going to run a little bit over time here. So the hemp market is really exploding. One of the statistics that changed is that the natural food stores overtook the online sales. Online sales were previously the leader, if I remember correctly. We see medical companies, clinics, medical doctors, online medical communities really taking off in terms of their CBD use. So the bottom line to me is that this market is being driven by consumer demand. And so my personal story about these patients in their mid-80s looking for a different approach to their health, that's really at the root of all this. So from a business opportunity for those who are considering entering, the public demand is dramatic. It's going to drive regulatory framework and changes. It does create startup opportunities, which are quite enticing. For me, clinically, seeing a lot of the research come along, and that was allowed to happen through regulatory changes. So Canada is now able to fund regulation through government agencies. And so, this story, this catch-22 of not having any research because you're not allowed to do research is ending pretty quickly. So you're seeing jurisdictions where that research is coming online, and I think that's going to accelerate things even further. So Israel, Canada, some other countries. I put down one of the opportunities is that the hesitation from some of these large consumer manufacturers, these large brands, they're not happy yet with the regulatory framework. So it creates an opportunity for some smaller companies to develop a brand, to build a reputation, to carve out some of the space and some of the shelf space, and possibly create a great business. And then we also see regulatory changes creating an influx of professionals. So you see major branding people, major advertising people, major packaging people. My experience with having access to biochemists and labs to produce products was because that regulatory framework was there. We all have to admit that the regulatory framework also creates some risk. And I prefer to think of it from a company perspective. There's risk in terms of cost of packaging. You make packaging and then regulations change and you have to eat the cost of packaging. So I consider it in that regards, but risk is changing and the regulatory system is changing very quickly. So this is us, and I love sharing my journey, and I love inspiring other people, and I love helping people. So if you have any questions, if there's anything we can share with you, we'd be more than happy to do so. And Lawrence Hudson is actually in charge of our CBD side of products, so she has a lot of knowledge about that. So if you're interested, we'd be happy to answer some questions there. So I hope that gives you a bit of insight.
If anybody has questions, come up here to the microphone, please, and ask your questions.
I think it's the biggest crowd I've ever seen for a regulatory discussion.
Thank you for your time.
Okay,
I noticed while looking at some of your products that you did have PEG 40 and a couple other ingredients in there, and just really looking at the contents that are in there. Can you address those?
Yeah, so that's a good regulatory question because PEG 40 from a smokable perspective is really bad for you, right? And then in some countries you're allowed PEG topically, in others you're not. So we have constant development of our products. So we have stuff in California that's different to stuff in other countries. But the PEG 40 is the worst news from that is that it was put into vape pens, right? And so people are then heating up something which turns into a carcinogen. Right, and that's a good example. If you have no regulatory framework, no lab testing, companies that are just out to make a lot of money, they put PEG in it, they reduce the concentration of it, customer buys it. It's a sad story. So
I just find in a lot of the lotions and things I create with
Yeah.
our company that we used PEG originally,
Yeah.
and the moment that we took it off of the ingredient list and we reformulated, our
Yeah.
sales, quadrupled because
Yeah.
the market is so focused on
Yeah.
that. It sounds like you have.
So it's off of our list.
Yeah, awesome.
I think we got a couple of people lined up at the microphone there.
We have a store in Mississippi, and we sell both kratom and CBD, and they both sell equally well. And those who imbibe kratom, they swear by it. Those who imbibe CBD, they swear by it. But when people ask me, what is the difference between one and the other? Because both of them take it for anxiety, for back pain and things like that. I don't have an answer.
Yeah, I think it would be a big challenge for you to have an answer because the research doesn't even fully clearly identify factors like that. So what we're in a fortunate position that we get a lot of consumer feedback, and we're collecting a lot of data. So from our perspective, we're able to start measuring stuff. But I think you're going to see the science help you identify that in a clearer manner. But for the moment, I think in your store, you could simply be quoting what you see consumer feedback in relation to those products.
Is the FDA more hostile to one than the other?
I think this is a big discussion about FDA and FDA regulations is a tough one for this room at this time. So I would probably not answer that question at the moment for you.
All right. Thank you.
I'm happy to chat with you afterwards. Yeah. Hi.
Hi, Doctor. Thanks for your time. Congrats on the brand. The packaging looks fantastic.
Thank you.
One of your later slides, you mentioned one of the challenges is claims.
Yeah.
And if you look at all the products that are out there on the floor, some mention pain, some do not. We're doing some product development around CBD products, and I was just curious how you guys think about that and manage that, the regulations and landscape, and your strategic approach, because it's not cheap to put paint on there and take it off and put it back on.
Yeah. Listen, we've had a fortunate opportunity to have lots of legal counsel and lots of review and lots of. So one of the things I was paying attention to is that these mainstream retailers, when they look at bringing products into their channels, are they concerned about that? So we've got their feedback from our products as well. So we're comfortable with where we stand. I do believe the claims, there are a lot of claims out there which I would not be comfortable making on product packaging. So I think there are companies at risk with major claims, you know, the list, cancer treatment, and various things, you know. Yeah. Yeah, but you know, the best advice is hire good legal counsel to be able to review all of your copy, from your packaging to what's on your website to what's on your social media. There are people out there with very good expertise at this point. So you got to track them down and find those and make sure you spend the money to get that reviewed. Yes?
Hi. So you previously spoke to treating a couple of your patients, the couple, the retired nun and
Yeah.
priest. So what were the indications that you used to treat them? So you treated them with THC versus treating another patient with CBD. I think you mentioned she had fibromyalgia. So if there are other indications, what would you personally treat CBD for?
So I actually, you know, again, in the Canadian regulatory system, it has nothing to do with the regulations. So you're going to make a recommendation on CBD or THC based on what the clinical discussion or clinical picture might be. Whereas here, it may be more of a regulatory thing. Can they actually access it? And if it's only CBD, they may be able to access it more than if it had THC in it, right?
Okay.
But the recommendation for them was specifically a 1-to-1 ratio of THC to CBD in their case. So it wasn't a specific CBD recommendation, it was a 1-to-1 THC CBD. And I practice around the corner from the Montreal General Hospital, where Dr. Mark Ware has done a lot of research, pain research, cannabinoid research for chronic pain. And so, you know, I've had good conversations with people and stuff and good insight. But that's part of this regulatory framework. As things roll out, you're going to see more and more research and more stuff that you can quote. But for them, it was a 1-to-1 THC CBD. Hi, afternoon.
So I have more of a commercial question. Is assuming the Farm Bill passes and assuming mass market retailers jump in, and I would think CVS in particular, given their focus on natural products now. From your perspective as a brand, who do you view as the three leading contenders to fill that CVS shelves?
Three leading brands?
Mm-hmm. Who do you think is most likely to end up in?
In what product
category? Because there's a plethora of micro brands, but...
I mean, very fascinating to walk around today. There is a plethora of brands, right? So there are a lot of people making a charge for shelf space. What I see is that it's taking more and more money to get there. So I did an interview last year where I said I think the opportunity to bootstrap a startup into, you know, with a trajectory into major retail is probably sailed at this point, you know. I can't disclose too much, but there's a brand with $900 million in annual sales that are looking.
Canadian brand.
What's that?
Canadian brand.
International brand. International brand. Looking at how to load CBD into their networks.
Do you see any of the FMCG companies jumping in?
Yeah, that's what I mean.
Are they already starting?
You know, the quote I was given is it's probably not long before Jergens puts CBD into one of their products.
Yeah.
You know, so Johnson & Johnson and you know, Johnson & Johnson has a lab outside of Toronto where they do product development, and because again the Canadian regulatory framework allows them to work with cannabinoids, there's stuff going on there. So definitely I get up every day and say the race is on.
Yeah.
But you know, we're very I'll say pleased with our position in terms of potential onto shelf space in the CVSs of the world.
Okay, thanks very much. Good luck with it.
Anyone else? All right, well, thank you very much.